Now we'll quickly try to look at another description, or you say another pathology. So this is what is known as periarticular osteopenia. So periarticular osteopenia just simply means there's loss of bone density, and this is around a joint. Do you understand? It's around a joint. It's around the joint that you're having the loss of bone density. Look at this. You can see the X-rays here. Instead of it to be white, around the joint is looking dark. So that's what we have. Let's quickly look at it. So periarticular osteopenia just refers to some localized bone loss. So there's decreased bone density, and this is around the joint. So it's usually dictated on imaging, all those plain radiographs, as an area of reduced bone opacity near the articular surfaces. So the pathophysiology is there's increased blood flow, so inflammatory condition increase the vascularity around the joint. Also disuse. Disuse, now you're talking about all those reduced mechanical, loading after injury or immobilization. So the person is no longer using that part of the body like they used to. So inflammation, this is when you have cytokines and mediators in arthritis. They stimulate osteoclast activity. So causes is all those inflammatory conditions like all those rheumatoid arthritis, psoriatic arthritis, juvenile idiopathic, arthritis. That sometimes it's after an injury. Sometimes it's after an injury. And sometimes it's due to infections. There's sometimes reflex sympathetic dystrophy. So radiographic features is there's diffuse or localized decreased bone density around that joint. You see it. And there's uniform loss of trabecular detail near the articular margins. See, periarticular osteopenia. This part is supposed to be so white, but it's becoming blackish because the density is lost. So that's what we got. So in contrast with osteoarthritis usually shows osteophytes. So you see all those bone growths around it. Okay, and sclerosis. So clinical significance is it helps us to early on diagnose this condition. It helps to differentiate between inflammatory and also degenerative joint diseases. It may indicate active disease requiring treatment, adjustment. Okay.